Welcome to the City Current Show, powered by Higginbotham Insurance and Financial Services.
This show focuses on sharing good news and powering the good in our community. Now here's your host, City Current CEO, Jeremy Park.
Welcome back to the City Current Show, powered by Higginbotham. I'm your host, Jeremy Park. We're always honored to bring you inspiring stories of individuals and organizations making a difference, empowering the good. And that's why we're honored to have with us a recipient of the 38th Annual Mary Catherine Strobel Volunteer Awards with Hands On Nashville. We're talking with Rincon Jagarlamudi, lead ambassador with Nashville Hip Hop Public Health. How are you doing?
I'm doing well, Jeremy. It's really nice to be able to talk to you today.
Well, congratulations. We'll talk all about the award, but let's start with you being at Vanderbilt. Give us a little bit of your background being a student, and then we'll talk all about the good work you're doing.
Yeah, so I kind of came to Vanderbilt. I'm now a rising senior, which means I'm entering my last year. I originally am from St. Louis, Missouri, and kind of came to Vanderbilt really excited to be able to kind of go to school at such a really prestigious and exciting school with so many opportunities. And one of those opportunities that came out of that was the ability to launch and run Hip Hop Public Health, which is something I've been able to do for the last 3 years and hope to continue to do for many more.
Where did that idea start? So when you talk about hip hop public health, how did you get involved? How did all this start?
Yeah, so it was truly like a really spontaneous occurrence. I actually was at a conference in Philadelphia. And at that conference, there's actually the founder of Hip Hop Public Health. His name is Dr. Elijah Day Williams, and he's actually a neurologist at Columbia University. And so he was doing a talk there talking about the program, how they use essentially hip hop music and hip hop culture to teach young kids about healthy habits and how to actually be able to help people like their parents and grandparents. And I remember just being blown away by first of all, how fun the music was. And second of all, the impact they were already making. They showed a video of a kid essentially being able to report his father having a stroke and be able to call 911 because of it. And that just completely left me blown away. And so what I did was reach out to Dr. Williams when I got back home and kind of express my interest in this is such a cool program. I'd love to be more involved. And it turns out that the program has been existing in New York City for over 20 years. But they haven't been able to expand that far into other cities thus far. And so I was able to kind of bring up the idea of trying to bring it to Nashville. And from there, kind of got started that way.
So talk about kind of the early phases of how do you reach out to schools and youth and get them in the program? How do you recruit other students to get, into this? And so you've been able to really build up, which is really amazing.
Yeah, it's truly is a challenge in itself of just getting the program off the ground. Because when you think about it, you need, like you mentioned, buy-in from the schools, buy-in from students at Vanderbilt to actually go teach the lessons. And when it came to that, it's always really challenging to get a school on board because they have their preset curriculum. They only have so many hours in the day that they have with their students. And you need to be able to convince them, hey, I'm going to bring in 4 college students to teach your kids using music. And at the beginning, that seems like a really tough sell and something that's the school might be like, oh, I might be a little bit hesitant to give this a try. But we were really fortunate actually to be able to have 2 schools kind of start with us at the beginning. Jones Padilla Elementary and Stratton Elementary were both really open to kind of getting us started in the beginning. And we were able to host our first lessons with them. They were like, we'll give this a try. We'll see how it goes. And then the students' response to it was super exciting. And they were able to keep us on for a couple of years. And we've been able to kind of use their good words and kind of spread further to more schools, which was really exciting. And I know you mentioned the actually getting the buy-in from Vanderbilt students as well. As you probably may know, may not know, college students are just very busy people. They have a lot of things going on, whether that's trying to balance academics, social life, and also just extracurriculars as well. So when it came to trying to get students on board, a big part of it was, first of all, just showing them the materials and showing them how exciting it is, showing them that this is an opportunity for you to be able to make a really significant impact in terms of teaching kids lifelong skills. but also giving them opportunities to kind of advocate for themselves and just be like, hey, I'm doing this really cool work. This is going to help me in my next stage of life, whether that is teaching, a teaching career, whether that is a career in public health or medical school or nursing school, anything under that umbrella. And so that was how we were able to get students on board to begin with.
How has this process helped you both as a leader, but also too reframing your perspective around being able to be a change maker in the community?
Yeah, absolutely. I mean, when I got started with this project in the first place, I had never really led a group of my own. And it truly came with a lot of like challenges to begin with in terms of how do I kind of inspire people and motivate them to buy in, right? Like I spoke about before, like oftentimes it comes from the leader themselves and them setting a really good example for the people that they're trying to like lead. And so one thing that came into was like, for example, a lot of our lessons, they would be at 8 a.m. in the morning and like first thing in the morning, and like any reasonable person would be so tired and in no mood to teach a lesson, especially a college student. And I think the leadership kind of came in the sense of essentially being the one who brought the energy, and then everyone else kind of hopped on board from that. So that was really helpful when it came to teaching lessons, but also when it came to like learning the skills, I was really fortunate to have a couple of mentors here at Vanderbilt that were able to essentially kind of give me guidance on what it's like to try and work with students and their busy schedules, and also guidance in terms of how can I try and get like funding sources to support the work that we're doing in schools. And so without their help also it wouldn't have been possible for sure.
How has this also connected you to the community? Because obviously on your end, coming to school at Vanderbilt, but from St. Louis in that area, how has this better connected you to Nashville and Middle Tennessee?
I'm so glad you asked that question because I feel like a lot of the learning that I've had about like Nashville has came through this program in the sense of when I go to the schools, I'm able to not only just teach the lessons, but I also spend a significant amount of time speaking to the students. Like, how is your life at home? What types of things do you like to do in your free time? And like, funny things will come up where they'll like recommend me new food spots and I'll like go try them. And it's like all thanks to them mentioning it. Or for example, students will be like, hey, I like to go play basketball here at this like community center down the street. And I'd have no idea. And I'm like, that's a perfect place for me to take my friends later, you know? And also just like the experience of being able to visit different schools in different communities in Nashville that I most likely would have never visited had I not been part of this program. Because of when you're in college, you very often just kind of exist within that bubble. And so being able to kind of go out and explore those types of areas, not only speak to the students, but also the teachers, you even get to speak to some of the parents as well, which is like super eye-opening to see this is the type of community that Nashville has. Is a really supportive community, and also just people that are genuinely just trying to do good. And that was something that I really loved when I went to all the schools.
I think that's something too. It's a powerful lesson for all college students. And when you talk about, getting off campus, getting immersed in the community, building those connections and those friendships, that's where it starts, is saying, hey, I want to be a part of the solution. I want to go and volunteer. I want to go and serve. And I think especially in your case, taking a leadership role in that, it just creates endless opportunities for you to connect and build this very large sphere of influence of people who you're going to care about, but they're going to care about you as well. And so I think that's, to me, such a powerful way to get immersed in the community. When you talk about, the best way to learn something is to teach something, how has that changed your perspective as well, being a teacher and, learning all of this? Have there been any kind of like aha moments like, oh, I didn't know that. Oh, that's a really good, like, how has that
Absolutely.
been?
Yeah, and I'm glad you mentioned it in the sense of that's actually one of the big things I pitch to students as well when they're interested in wanting to learn more about the program, is that you get a lot out of it as well in terms of learning about how community health works. One of the things we talk a lot about with like my college students that go out and volunteer is this idea of like the social determinants of health. So these are things like, in this community that you're going to, are there easy food sources where students can go and get healthy meals? Are there things like parks nearby, or is the only type of food source in that area just a gas station or like a small corner store around the corner? Those are the types of things that I tell my student volunteers to be really conscious about, because it teaches you a lot too, as someone who wants to be involved in either teaching or the healthcare industry, that there's a lot more to a person than just, let's say you're a doctor. There's a lot more to a person than just their condition. A lot of it has to do with where they live, where they grew up, what type of families they had, and being able to go into these schools, speak to the students, hear their stories, makes you really cognizant of that. And so a lot of our graduates who went through the program and worked are going on to medical school, some of them going into teaching careers. And I really can imagine that to be the same case for me. I'm also interested in applying to medical school after I graduate. So for me, that's going to be something that will stay with me forever, where I'll be very conscious of this kind of issue of thinking about the environment of a patient when they were to come into my room for an appointment, for example.
Yeah, absolutely. Carry that into your goals for the organization, for the program. So when you look at the sustainability of this and getting more people involved, getting the community involved, you mentioned the funding too, and those opportunities. What are some of your goals looking forward?
Absolutely. And this is something that is a question that's always on my mind, because I'm only going to be in college for so long, right? And I never know what the journey is going to be from here on out. And so I know that for the past 3 and eventually 4 years, I'll be working on getting this project off the ground, but it's really important that it continues even after I leave college. And so right now I'm working with a couple of student organizations on campus to see if we can kind of bring hip hop public health under their umbrella. Vanderbilt has a really large science education program called Vanderbilt Students that teach science, and we're going to try and bring it under their umbrella. So that way we can have a bunch more volunteers kind of using the hip hop public health framework to teach students about really important health information. Because to me, that's really important. I don't want it to just be something that I do during my time here. I want it to be something that Nashville students can be able to partake in for many years to come.
Well, congratulations again on being part of the 38th annual Mary Catherine Strobel Volunteer Awards with Hands On Nashville, being one of the recipients of that award. It's a huge honor. And so what does that mean to you personally to be a recipient of that award?
For me, it's truly just an exciting opportunity for me to be able to get the word out there. Like, for example, through City Current, for example, I'm getting the word out, but also just at the award ceremony itself, I was able to connect with so many other change makers in the community, like some local politicians, people who are leading nonprofits, and the opportunity to network with those individuals and be able to say that I'm this recipient of this Strobel Award is really helpful, because now it kind of brings a sense of credibility to the work that I'm doing, and really opens the doors to really exciting partnerships that I hope will ensure that we can create a sustainable project for hip hop public health to last for many years to come.
How can the community get involved? So talk about obviously the financial donations, but ways to volunteer. How can the community help?
Absolutely. When it comes to how the community can get involved, the first thing I always recommend people to do is check out our website. It's a really simple website. It's hhph.org. And there's going to be a vast variety of different resources that people can check out in terms of how they can get involved. We have our newly launched Health MC program, which essentially allows literally anyone who's interested to access our wide array of lesson toolkits that they can share with their kids, with their grandkids, with even if they're interested in teaching it in their own schools. If you're a teacher, you can go out and do that. It's free to access for anyone, and it's a really exciting opportunity for you to teach truly life-saving information to children if you're interested. In terms of the work that we're doing here in Nashville, a lot of our funding comes through the Vanderbilt University route, but we're really grateful for all of their support. This includes people like the Josie Davis Fund and the Office of Immersion at Vanderbilt that have been really supportive over the past couple of years.
Give me one of your favorite experiences so far. Obviously, receiving the award, that's one of them. But, when you talk about working with schools, working with youth, working with your fellow students, what's a moment that puts a smile on your face, the one that, pops into your head first?
Yeah, I think the one story that comes most into my mind is this one where there's a student that I had been working that I've been in this class for I think at that point 3 months now, and we had actually just finished the what we call our hip hop stroke lesson, which teaches kids about the symptoms of a stroke, and being able to report those symptoms and call 911 if that were to happen. And then so after that lesson, a couple weeks later. I walked into the classroom and one student comes up to me and he's like really, really excited because his mom, of course, his mom actually didn't suffer a stroke, but she was suffering a medical emergency. And because the hip hop stroke lesson had taught him the ways to call 911, what types of skills you can use, and what you should be saying to a 911 operator, he was able to report that for his mom and make sure that she was able to get the care that she needed. And that was truly like for me, like a really like impactful moment because I was able to realize this work that I'm doing, improving health literacy, is gonna really leave an actual lasting impact. And that was really one of my favorite moments so far.
Yeah, that's amazing. And I mean, it just goes to show something, simple can be very profound in terms of life-saving opportunities. And so I think that's, to me, what it's all about. Well, congratulations again. Wrap up one more time with website. Where can we go to learn more, to get involved with Hip Hop Public Health?
Absolutely. Website is hhph.org. There you can, if you type in hip hop public health, you should be able to find any of the socials. That includes the Instagram, Twitter account. I guess it's called X now, but literally anything under the sun will be found at that website. Just look us up at Hip Hop Public Health, and there's going to be a lot for you to take a look at.
Well, Rincon, congratulations again. Thank you for all you do to power the good with Nashville Hip Hop Public Health. Thank you for coming on the show.
Awesome. Thank you, Jeremy.
Higginbotham Insurance and Financial Services is proud to power the City Current Show. We're a people-first company that protects what matters most, the families, businesses, and trailblazers that keep our community going. As one of the nation's top independent insurance firms, Higginbotham is a single-source solution for business insurance, employee benefits, HR services, and personal insurance that's customized for you. We're here to serve you, the people you care about, and your community. Call 866-377-1959 or visit higginbotham.com.